Hi everyone, I'm Zoe from My Progression, and in this video I'm going to discuss the importance of being allergy aware in schools and give you a 4 simple step process to follow if you encounter someone with an allergic reaction. An allergy is when the body's immune system reacts to something that would not usually cause an immune response in most people, like a type of food, an insect sting, or material. The body reacts as if it's a dangerous threat. The substance that triggers this reaction is called an allergen. When someone with an allergy comes into contact with an allergen, this can cause an allergic reaction. Regardless of your role, it's vital that you understand different allergies, what an allergic reaction looks like, and what to do if a child or member of staff is suffering from a severe and potentially life-threatening reaction that needs immediate attention. Whilst this video is informative, it is guidance and not official first aid training, so it's important that you still seek advice from a first aider before working with pupils with severe allergies. At My Progression, we aim to share informative videos to support you in a wide range of job roles in schools. Have a look at the variety of our videos on our channel. By subscribing to our channel, it means you'll never miss a new video. And don't forget, give this video a like whilst you're here. So, what different allergies are there? Well, people can be allergic to a wide range of substances, and the long list of different allergies may surprise you, with rare allergies even including the sun and the cold. However, these are very uncommon and not something we are going to cover today. Now, children can have many of the same allergies as adults, but some are more common in childhood. Allergies can vary in severity. Food allergies often show up in early childhood and tend to be more common in children than adults. Some children can outgrow certain food allergies, like milk or eggs, but nut allergies are usually lifelong. Other allergies include environmental, insect stings, medication, and skin and contact allergies, which are triggered by direct contact with allergens. Now, allergies can impact anyone, regardless of age, gender, socioeconomic status, or race. There are different factors as to why someone might develop an allergy, with one of the most common being family history and genetics. People who have parents with allergies have an increased risk of developing allergies themselves. However, the development of allergies has also been linked to lifestyle and environmental exposures. What is anaphylaxis? You may have heard the word anaphylaxis when discussing allergies, and it's essential that you understand and recognise this term due to its severity. Anaphylaxis is a severe and life-threatening allergic reaction that comes on quickly and needs immediate medical treatment. It affects multiple parts of the body, especially the airways, breathing, and circulation. Anaphylaxis can be triggered by any allergen, but the most common causes in children are peanuts, shellfish, milk, eggs, insect stings, especially wasps and bees, and latex. So, what should you do when a child is having an allergic reaction? Whether it's mild or severe, quick and calm action is key. There are different steps that it's important to take when you think a child is having an allergic reaction. In every setting, there should be a first aid lead and designated first aiders, but it's important that everyone knows what to do when working with children with specific allergies and care plans. Here is some guidance on the steps you could take in an emergency situation. Step 1. Stay calm and assess the situation. Look for signs of allergic reaction. These could include mild signs such as itchy skin, hives, mild swelling, or stomach pain. There could also be severe signs, known as anaphylaxis, as previously mentioned. These symptoms could include swelling of the throat or tongue, breathing difficulties, dizziness, collapsing, or a hoarse voice. These are severe and could be life-threatening, so acting quickly is vital here. Step 2. Use the child's emergency plan. If the child has a healthcare or allergy action plan, follow it immediately. This may include giving antihistamines for mild reactions or an adrenaline auto-injector for more serious ones. Different schools have different policies when it comes to administering an auto-injector, with some schools specifying you must be first aid trained to do so. Generally, you would not be expected to do this alone, as a first aid trainer or at least another adult is usually close by. Always seek further training from your first aid lead if you do have a child in your class or year group with severe allergies and you need more support. Step 3. If it's anaphylaxis, you must use the auto-injector immediately following the child's care plan. give the adrenaline auto-injector, for example an EpiPen, into the outer thigh and make a note of the time it was given. Someone must call 999 immediately and clearly state a child is having an anaphylactic reaction. Again, this video is guidance. You must follow the child's individual care plan and the school's allergy policy and first aid training throughout the allergic reaction. Step 4. Position the child safely and stay with them. If possible, lay the child flat with their legs raised, as this will help the blood flow. However, if they're struggling to breathe, sit them upright. Do not let the child walk or stand up suddenly, as this could cause a sudden drop in blood pressure. Throughout this time, just reassure them and monitor them closely. And afterwards, give any paramedics a copy of their care plan if you have it available. At the first suitable opportunity, the child's parents or carers must be contacted and relevant school staff, including the safeguarding lead, must be informed if they're not already aware. So, what are your responsibilities when it comes to allergy awareness? Whether you're on supply or you have a permanent role in a school, there are some essential things that you must know. Firstly, emergency medications should be easily accessible and not locked away. Every staff member must know where it is and it should be clearly labelled for the individual children. This means that all healthcare plans must be updated regularly, especially with new allergies or medications. These plans should be positioned clearly in an area that all staff members can see, for example, in the staff room. Schools are responsible for training their staff in allergy awareness and how to use an auto-injector. Practicing with training pens is a great way to build confidence in using these auto-injectors in case an emergency does occur. However, if you're a supply member of staff and do not receive this training, it's important that you keep your own knowledge up to date and always ask if there are any pupils with allergies in your class. Reading individual healthcare plans is a vital part of your role and it is a safeguarding responsibility. If you're on supply in a new school and have any questions about medication, healthcare plans or safeguarding, it is vital that you ask a member of staff, first aider or safeguarding lead. My progression focused on giving both permanent and supply staff valuable CPD to support every educator in their career development. We have a wide range of videos varying from classroom management to understanding trauma. A video sequence I would recommend you watching after this is our 3-part safeguarding series, as in an educational setting, safeguarding is everyone's responsibility, so it is essential that you know the basics. As an educational staff member, it is your responsibility to avoid accidental exposure to allergens, especially during meals, activities or trips, and to make sure every child is protected, supported and never left out because of their condition. Now, you may choose to use food treats to reward children when they've achieved something, for example, if they've won Star of the Week or if they've just completed a brilliant piece of work. However, if you have a child with food allergies in your classroom, avoid using food as treats where possible and try and use more inclusive prizes so that every child can be involved. It's important that you know the allergies of pupils within the classroom, so if you do choose to use food as treats and have parental permission to do so, they should not contain any of the ingredients for any allergies in your class. It's crucial to mention that some severe allergies can be airborne, therefore it's vital that you also do not eat these foods during your break or lunch. Many schools, colleges and nurseries aim to be nut-free and ask pupils and staff not to bring food in containing them. However, as expected, this cannot be guaranteed, as in schools, not all pupils' snacks can be checked. For more advice, Allergy UK have created helpful tools and resources to help keep children with allergies safe in school. A link to their website is detailed in this video's description. It is so important for all school staff to have allergy awareness because allergic reactions can happen quickly and without warning. In some cases, they can also be life-threatening. With allergies on the rise among children in the UK, it's likely that every school will have pupils with serious allergies to foods, insect stings or other triggers. Staff need to be able to recognise the signs of an allergic reaction, know how to respond appropriately and act fast in an emergency, especially when it comes to anaphylaxis. Being allergy aware not only helps protect the health and safety of vulnerable pupils, but also creates an inclusive, supportive environment where all children can feel safe, understood and fully included in school life. I've been Zoe from My Progression. Let's keep your career in motion.